Welcome to this Three Rivers Department of Rural Health presentation. We would like to acknowledge the Wiradjuri people of Australia, who are the traditional owners and custodians of the lands in which this learning resource has been developed. These lands have always been places of learning. We pay our respects to elders both past and present and emerging, and honour them for maintaining the cultural and intellectual foundations that ensure these traditions continue in perpetuity. I'm Kay Skidman. I've developed this resource in conjunction with Three Rivers UDRH. I've been supervising physiotherapy service learning placements for several years for Three Rivers. My background includes 2 decades working rurally as a physiotherapist in charge with generalist and paediatric physiotherapy clinical caseloads and student supervision. I also worked at Charles Sturt University as a lecturer in physiotherapy for over a decade. Many of the tips that I cover in this presentation have been developed as a result of supervising physiotherapy and allied health students in non-traditional interprofessional placement settings, both overseas in Vietnam and in rural New South Wales. I would like to acknowledge the collegiate work of my allied health colleagues at CSU in the development of these approaches and strategies. These learning outcomes have been designed to support both you as a supervisor and your physiotherapy students as you become familiar with the differing demands and requirements of a service learning placement. Learning outcome. Develop an understanding of the role of the physiotherapy supervisor in service learning placements. Students undertaking service learning placements are supported to design and complete a project in their host organisation. An allied health professional may or may not already be working at the host organisation. Where there's no allied health professional working within the organisation, the student is supervised on-site by a suitably trained professional within the facility and regularly, usually weekly, by an off-site discipline-specific professional supervisor, either from a private facility or a university. Examples from my own experience include placements at Yaranagarnia in Forbes, where the students developed culturally appropriate falls prevention screening tools and programs. Placements at Walu Win, which is an initiative of the Orange Aboriginal Medical Service, where the project outcomes included culturally appropriate adaptation of assessment tools, targeted exercise programs for Indigenous elders with chronic medical conditions, and the Be Well project, which is pulmonary rehabilitation. And I've also supervised interprofessional allied health service learning placements at Glenroy Heights Public School, involving both physiotherapy and occupational therapy students, whose project focused on fine motor skills and development of core stability amongst kindergarten students. In these placements, the on-site supervisors came from a range of professions: nursing, exercise physiology, and teaching. Here's a copy of the Three Rivers Service Learning Placement Model. I would encourage you to go to the link on the screen to view more closely the community, student and host organisation roles in this model. For now though, we'll focus on the clinical supervisor role. Key points here will relate to communication pathways with the other supervisors in the team and your students, and best practice in shared assessment. The clinical focus in these placements is concentrated on the project. There may be opportunities during the placement to provide other incidental clinical learning experiences, but it's important to remember that these are not the focus of the student learning. Supervising students in these service models is different from traditional supervision, but in an exciting way. I love supervising these non-traditional interprofessional placements. When our students are well prepared for the placement and understand the focus is on interprofessional teamwork and project outcomes, they're able to embrace the concept, work together as a team with the organisational staff, and learn about, with and from each other. It's lovely to see their professional growth. While the students may not have a full-time clinical caseload, it is still possible to assess the competencies as required by the universities. Both the supervisor and students value the supervision and assessment input of the on-site organisational supervisors. There will always be a need for a discipline-specific supervisor, but that person doesn't need to be the only one. In fact, there are distinct advantages in shared supervision. Shared supervision takes the load off any one person to be responsible for the student, and as long as the students have a good understanding of how the process works, they find it quite acceptable. Students appreciate the fact that the good work they're doing while I'm not there is also being recognised. The role of the physiotherapy supervisor, what it is. We need to keep our focus on the learning opportunities provided by the project, very much in consultation with the organisation. We help the students educate the organisation on what physiotherapy may have to offer that is relevant to their organisational goals and priorities. The photo you see for what it is relates to the upskilling of Orange Aboriginal health practitioners on safe exercising for adults with lung disease. We help the students identify and value the learning opportunities that include clinical physio aspects, but are also much broader than this: cultural, interprofessional, including professions outside of health, strengths-based, rural, and we could go on. We help the students to develop a project that is doable, not too big, not too general, not requiring resources that aren't always available and not reliant on us. We may also identify potential projects for future placements as part of this process. And of course, we make sure, as we always do, that anything the students do is safe, effective, based on evidence, and has definable and measurable outcomes. What it isn't. Our role isn't to invent clinical learning opportunities that don't relate to the project. Our role is not to provide clinically focused in-services unless these are directly related to the project. And our role is not to provide a service to the organisation that isn't sustainable when we're gone. Learning outcome. Be able to explain the student learning objectives of a service learning placement. Student learning objectives are customised to each placement site, but will be of a similar content to this example here, which is for a child care centre placement. What is important here is that we're able to support our students in understanding and prioritising these learning objectives. If we can do this, then many of their concerns and challenges around this non-traditional placement format are addressed in a proactive and a positive way before they're even able to fully articulate these concerns, and definitely before the concerns develop into a problem. Our students are nearly always assessment focused and success orientated. So acknowledging this up front and reassuring the students that their placements are extremely valuable learning opportunities that also allow for good assessment results is something that I address in a structured assessment process that starts even before the placement commences. It can also be handy to point out to the students that all new graduate physios have essentially the same skills and attributes to try and sell to their new employers, and that these projects can give them something that will help them to stand out from the crowd. Learning outcome. Be able to explain and facilitate the shared assessment process used in service learning placements. Before placements start and throughout the placement, make sure that your students understand the shared assessment process, including the benefits for them, and support the students in relation to the assessment process. I'll come back to this later in the presentation when we focus specifically on supporting students. Early in the placement. Discuss the shared assessment process with the on-site supervisors to confirm what your approach is going to be, and refine the shared assessment tool to reflect the on-site supervisor's contribution to the assessment and agree on the process. The small amount of time that this takes pays big dividends across the placement, and it will only often need to be done once for any site. Timetable in your midway and final assessments into the schedule for both yourself and the staff. For example, in a childcare centre, a good time to get feedback is when the children are having their after lunch nap. Obtain assessment feedback from the on-site supervisors. I find it useful to offer a range of options where possible. Some supervisors prefer email correspondence and to fill out the form themselves, but many prefer to just have a conversation where I ask specific questions linked to the form and fill it out for them as we go. Good practice would then be able to confirm that they're happy with what we have down, either by summarising it or having them read the form, and then making sure that they're aware that the students will be getting this feedback, generally in a summarised version which is included in our own APP. A key point here is for us to give professional respect to the other supervisors, and that means accepting their feedback as though it were our own. This will, of course, also be reinforced or modified by our own observations of the students. I will go into more detail about the shared assessment tool in the following slides. And finally, in the shared assessment process, across the second half of the placement, we actively integrate aspects of the APP into the project report, and I'll give you examples of what this might look like. And we structure student contributions in a way that allows assessment of both team and individual contributions. We also need to clarify with the students how you will assess the remaining APP indicators that have not yet been addressed at the halfway assessment. I'll give you examples of what all of these three strategies may look like. And of course, don't forget to obtain the final assessment feedback from our on-site supervisors. This is often quicker and easier than the midway assessment. Here we have an example of the shared assessment tool. You'll notice two things in this tool. There are clear links to the type of things that we assess using the APP, and all of these aspects of student assessment are not physiotherapy specific, but rather are generic skills that are developed and assessed in the broader range of health and education professionals. This means that your co-supervisors are very likely to feel comfortable commenting on these aspects of student performance. However, this is where you take the generic version of the form and either refine the wording and or take out aspects that other supervisors don't feel able to comment on. So this particular version here was developed in collaboration with the kindergarten teachers during one short session and was based on a generic template that we went through with them. Here's the second page of the example, where you can see specific adjustments, such as selects appropriate games and activities which link to helping students participate in school learning opportunities. Learning outcome, to develop an understanding of how to assess students' performance on a service learning placement using the APP. Before we talk about interpreting the APP in the context of service learning placements, a good place to start is to refamiliarise yourself with how the APP works on typical placements. For all supervisors, including those of us who may be more experienced, a refresh and reset of our interpretation is always useful. There are some key points to consider as we then move on to reframe the APP for service learning. We'll go through these points one by one. Specific examples of key points. Think more broadly about who the client is. So there are several ways that you can think about who the client is as you look at the APP. So the organisation itself can be the client. For example, APP 18 undertakes discharge planning. This becomes about planning from the very start of the placement for the sustainability of the outcomes of the project once the students are gone. Another example of where the client becomes the organisation itself is 11, identifies and prioritises patient or client's problems, which would become identifies and prioritises organisational problems where physiotherapy has something to offer. Secondly, the staff of the organisation who will be using the project resources or outcomes can also be considered as clients. An obvious one here would be APP 15, is an effective educator or health promoter, where the students are educating the staff. And another one that is perhaps less obvious but makes a lot of sense and can often be relevant is APP 13, selects appropriate intervention in collaboration with the patient or client. In fact, my experience suggests that if the students don't engage with this particular one with the staff, if they don't collaborate with the staff, then the likelihood of the project having sustainability after the students leave becomes very low. So these two performance indicators can work very closely together with the educator ones in relation to the staff of this organisation. Generally, the projects that our physiotherapy students develop do directly target clients, and there are some client interventions that may occur that we can assess on the APP. For example, mass screening of clients for a particular issue, such as falls prevention, gross motor development in children, baseline measurements for group attendance at pulmonary rehab, etc. However, it's important to emphasise to the students that these are only a priority in the context of their relevance to the project. Specific examples of key points. Actively integrate aspects of the APP into the project report. Feedback from staff is one of the ways we can assess the students, but we can also use their project report. Gaps in the midway assessment can specifically be targeted in the report. This is one example of the sections of a project report and how these were linked to the APP. Immediately after the student's midway review, timetable a specific meeting on how you're going to assess those aspects of the APP that you haven't yet addressed. Don't be surprised or concerned if there's quite a lot of the APP that you couldn't complete at the midway review. This is commonly the case. So the purpose of the meeting is to clearly outline for the students how these aspects will be assessed, and the report will be a key part of this. You may also wish to have the students complete case studies to address other aspects of the APP. It also becomes relevant to discuss with the students how you will be able to separate out their individual contributions while still maintaining a team approach. We'll come back to this in the next slide. Specific example of key points. The next key point is to structure the student contributions in a way that allows assessment of both team and individual contributions. There are many opportunities on these placements for assessing APP4 demonstrates teamwork, so the final report is just one small aspect of that. Therefore, it can be very useful to clearly determine with the students how you will assess their individual contributions to the report. There is more than one way of doing this. However, I do find it useful to require them to do some aspects individually. For example, in the above report, the students were required to develop short and long-term goals for the project. These goals had to be SMART and were divided up in a way that allowed individual assessment of each student. Similarly, the literature review was considered a component of their demonstration of evidence-based practice, and within the literature review, each student had a subtopic that they had to complete, so that I could assess these two aspects individually. Specific examples of key points. Is there something that I truly can't assess? How does that work? There may well be a performance indicator, or perhaps two, that you don't feel you can assess. It is perfectly okay to have an indicator as not assessed. It is important, if this is the case, that you make sure the student understands that their mark is adjusted to take this into account in the final percentage. However, there really shouldn't be more than 2 sections at the most that you're unable to assess, so please do get in touch with the UDRH if you feel that you're unable to assess a significant number of aspects of the APP. Learning outcome. Develop an understanding of how to support students in relation to the assessment process. Key point. Make sure the students understand the assessment process. This will help them to feel heard, understood and comfortable with the assessment in this unusual context. Talk broadly about the assessment process before the placement even starts. Reassure the students that it is our job as supervisors to work out how we're going to assess them, and it's not something they need to worry about. Talk to the students about the benefits of having a shared assessment process. One of the main ones being that all the wonderful work that they're doing when we're not there still gets recognised. Preempt the progressive rollout of assessment items across the placement. As we mentioned earlier, it's quite common on these placements that there's quite a lot of the APP that you can't assess at the midway review. Reassure the students that you'll sit down and clearly identify with them how the missing parts will be assessed. Meet with them as soon as possible after their midway review to complete this process. All of the hints and ideas that I've covered across this resource means that you should have ample ideas of how this can happen. Here we have the references that I've spoken to in the presentation and links to those references if you should need them. Thank you for listening to this presentation. I hope you enjoy working with the students as much as I have.